In this episode, we're going to talk about nursing education advocations. So, health education is planned, organized, and systemic social and educational activity to promote voluntary changes in poor health behavior and factors affecting health behavior, eliminate or reduce risk factor affecting health, prevent disease, promote health, and improve the quality of care. So, why health education? So, health education is the first and foremost part of hospital health work. Health education is the therapeutic factor. It is an important link to strengthen therapeutic relationship and reduce medical conflicts. And some advantage for health education for patients. First, is good to promote therapeutic relationship, increasing the patient's sense of reliability and security to the nurses. Make patient understand to treatment, prevention, and healthcare of disease by themselves. Patients can actively cooperate with treatment and care. And for nurses, the beneficial things are enrich knowledge, update knowledge, and improve the constituency of nurses with learning, confirm the uniqueness and scientific nature of nursing expertise. It reflects the purpose of serving patients and the value of social contribution. And the process is divided into 5 stages. Analyze for patients' needs, determine the objects, draw up the education plan, implementation of the education plan, and evaluation. To analyze the patient's need, we need to understand the patient's psychological state and disease concern. We need to understand their own knowledge level and knowledge of the disease that he or she is currently suffering from, their previous lifestyle and health concept, their social support thing. And next up, for the goals, should be concrete rather than abstract. Consider the following factor when determining transactional goals. So, what knowledge and skills does the patient lack? What are the patient's interests, and what is the patient's literacy and receptibility? Assessing the difficulty of the goals and decide the order of accomplishing the goals. To formulate the education plan, we need to formulate the education time and location, the content, who is doing the healthcare teaching, and the method and tools. And for the content on patient education and advocacy, we need to educate them on public health knowledge, help patient understand the cause of disease, pathogenesis, principle of treatment, common complication, reasonable arrangement for diet, rest, sleep, and reasonable use of medication. Instruct patient on ways to reduce various factors affecting health and prevent complications. Mental health education, provide patients with medical knowledge about rehabilitation and relapse prevention during hospitalization and after discharge. The content of education should be basic, simple, important, practical, and repeated to deepen the impression. And for evaluation, the planning, implementation, evaluation is a continuous process. It could be conducted at any time, and the purpose is to modify the original plan at any time to improve the work. By teaching the patient's knowledge and skills about the disease, the nurse motivates the patient to actively participate in nursing activities to improve self-care and restore health.